In case you don't know what's happening, this right here is David V. He is a 47-year-old man who is experiencing pain at the scrotum. As the patient had made his way into the hospital, he had noted that he had been experiencing symptoms such as a dull aching pain, mostly on the left side. It also feels like a bag of worms. And in some patients, the scrotum can actually feel heavy. However, in these types of cases, there are usually no symptoms, but our patient here, David, is one of the unlucky ones. David's symptoms started yesterday while he was working at his construction job. These types of jobs involve standing for long periods of time, which might have been a trigger to David's symptoms. However, something that improved these symptoms would be, say, laying down or going to sleep, as it would take the tension off the scrotum. However, these improvements are not temporary, as they can lead to reoccurrence after standing for too long. Some risk factors can include infertility, reduced sperm reduction, and much more. So let's leave it to the doctor to see what it is.
So doctor, tell me what's wrong.
Well, after hearing what you have to say, I can assume that you have varicocele. But just to confirm, I'm going to give you 3 test options in which you could take.
Okay, sounds good, doc. Just name them.
So first up is the Varicocele maneuver, and this increases pressure, which will allow for the veins in the scrotum to show themselves. This will be able to expose the veins in the scrotum, which will help in our diagnosis. Next up is the Doppler ultrasound, which uses sound waves to measure blood flow in your blood vessels. This will help with confirmation of the diagnosis and assessing severity for varicocele. Lastly, we have semen analysis. This examines the quality, quantity, and function of sperm in the semen. This will help determine the damage caused by varicocele.
Yeah, just give me the Varicocele maneuver, whatever you call it. How's it look, doc?
Well, I got the results back, and it is confirmed that you have varicocele. I'll show you this diagram so you can see what you have.
Okay, so what am I looking at?
You see the 2 diagrams from the top left and the bottom right?
Yeah, I think the top left one is the normal one, and the bottom right one is mine.
You would be right. The top left one shows the normal male reproductive system, and the bottom right represents the male reproductive system affected by varicocele. In the normal male reproductive system, you can see that the veins, also known as the pampiniform plexus, is normal sized here. They are quite skinny and wrap around the epididymis. But on the contrary, the ones affected by varicocele are much more enlarged. And this could block the pathway for hormones such as testosterone and can also lead to higher FSH and LH in some men.
So you're saying I could turn into a woman?
Not necessarily, but since the spermatocords in the scrotum are not working, this can cause infertility by raising testicular temperatures and causing damage to the sperm.
So doc, what are my options here?
So there are 3 separate treatments in which we can do in order to help you. So I will list 3 recommendations on which one I would personally choose for you.
Please don't do this again, doctor.
So the first up is a microsurgical varicocelectomy. This process involves making a small incision near the groin before using a microscope to locate and tie off the dilated veins while preserving the testicular artery. This is considered the gold standard by many for its high success rates and lower recurrence risk due to precise identification of vessels. Next is a laparoscopic surgery. This uses small incisions and a camera to see and cut off the vein, a quick operation. This has faster recovery than traditional varicoceletomy but comes at higher reoccurrence rates. Lastly, we have the varicocele embolization. This works by putting a tube, aka a catheter, into the groin vein. It then injects cons or liquid substances, which blocks the blood inside. This avoids large incisions, has faster post-surgery recovery, and good for those who had prior surgery near the groin. A personal suggestion by me.
Well, I'll get the embolization then. How'd it go, doc?
The treatment went well. Earlier to see improvements in scrotal pain and an increased sperm count. Without it, you probably would have been infertile.
Permanently. In the end, 47-year-old David V had came in with symptoms of a dull ache and heaviness in the scrotum, which started yesterday. After a procedure called the Varicocele maneuver, he was diagnosed with varicocele. Varicocele embolization had helped this man recover. The end.